Clear Aligners, Essentials and Beyond, Thursday, Friday, and Saturday, April 18, 19, and 20. A hands-on experience limited to 35 attendees.
Phil, you're enrolled in our upcoming 2.5-day April meeting with Lee, Boyd, and with me. Again, a very limited attendance meeting. What do you expect to gain from that session?
You have a very great ability to curate great relationships between people. So I'm just excited to, meet more people that are like-minded. But again, just coming off of your CMDD course and the December course, I just want to dive more into the diagnosis and continue learning about the traditional mechanics and its application in clear aligner therapy.
Yeah, that's exactly what we have in mind, which is why it's 2.5 days. There will be a lot of essential information about diagnosis, prognosis, treatment planning, and the very real situations where what if the patient, whether it's a mixed dentition or a teenager, what if the patient is not being cooperative? Where does that stand? And what about changing them to fixed appliances? Or what about if the clinician is not really prepared to do that? How would the parent, teenager, or mixed dentition patient be informed of that? In addition to all the cases that we're going to show.
Yeah, I'm excited for that.
Well, Phil, I'm delighted you're enrolled in the meeting, and it's always a pleasure to speak with you.
Yeah, thanks for having me.
Well, thanks for taking the time, Phil.